shin splints. When you have an athlete with shin splints, this is a good way to help limit that pain. So you have the athlete stand with their knee slightly flexed, just like in the position that Patty is right now. With this, we also apply the adherent spray. And we have different types of tape, like we have a stretchy tape that we will use, but just for this purpose, I'll show you guys how to use it with regular tape. So you start about right here on the lower leg, kind of underneath the calf muscle, or where you would start like an ankle taping. So those are one set of your anchors. The other set, you find the patient's tibial tuberosity, or this little bump. Some people have really big bumps, some people have small ones, so you kind of have to feel or palpate where that is, and you just go right below that. You apply 2 more anchors. No, it doesn't matter which way you put these on. And then you do stirrups along the side. 1 on each side is what I generally do. Okay, like that. And that's the base of your taping right here. Now I'm going to do some overlapping strips. The way I do it is probably different than what the book shows, but I'll just explain what I do, and then I'll show you guys what the book does. For me, I usually go all the way one direction like this, and go all the way up, and then when I come down I do the opposite direction, but your book shows you to overlap the strips like this. So you pull at an angle, and you adhere the tape to your stirrup along the outside, always overlapping by half of what you've already done. So you're kind of making a braid as you go up. You're pulling to the inside and to the outside when you're making these strips. Did you test us? Do you care which way we do it? Or do you want us to do it the book way?
Whatever way you would rather do it. Bottom line with all the taping is, as long as the structure points are there, the process that you get there, it really doesn't matter. Because every single one of us do every single tape job, probably completely different, but we all get the same process done.
Yep, so when you work your way up after doing the weaving, some athletes will have shorter shins, and others, like a basketball center, is going to have a really long tibia. So you'll want to use more tape on them. But after you get done, you put on another stirrup to cover up all your tape ends on both sides, and then you apply the anchors again. 2 on each is the general rule of thumb for anchors. Okay, the shin.